Guardian Radio, your station for up-to-the-minute news and intelligent, interactive, and engaging conversations. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the views of the management and staff of Guardian Radio.
With early detection comes early prevention.
Put lead in your pencil, make you feel like a champion.
Rise up again, let nothing keep you down. Live your best. Hear the urologist speak. Oh yeah.
Think you're losing grip of your manhood, don't give up on hope.
Don't be ashamed, it's time to take control. Get some help from the urologist.
You will find
He'll help you solve your problems
on 96.9, yeah.
I telling you, with early detection
Comes early prevention.
put lead in your pencil, make you feel like a champion.
Rise up again,
Let nothing keep you down. Live your best.
Good evening, Bahamas. This is Urologist Speaks with Bahamian Urologist Dr. Greggory Pinto and my co-host, as always, Dr. Wesley Francis, who is a Bahamian general surgeon and surgical oncologist. We are honored to have someone I've known for 30 years. She was in the same internship group with me 25 years ago. Actually, we spent 6 months together at Sandilands Rehabilitation Center when I thought I wanted to be a psychiatrist, and then I changed my mind. We have the world-respected and she's a selfless individual. Let's take away her accolades and her academic achievements, but she's a selfless and good person, probably one of the best persons I've ever met, and that is Dr. Annalease Richards, who's a child and adolescent psychiatrist and a Bahamian at that. Good evening, Dr. Francis.
Good evening, Bahamas, and welcome, Dr. Richards.
Thank you so very much.
So as always, we always want to hear a little bit about yourself, your journey, your family, where you grew up, what high school you went to, et cetera, et cetera. Let's get to know Dr. Annalease Richards, Bahamian child and adolescent psychiatrist.
Sure. Thank you so much for having me this evening. And I'm going to have to ask Dr. Pinto to open for me wherever I go. So thank you for that introduction. As you mentioned, Bahamian, I always say, everywhere I go, Bahamian born, Bahamian bred, a daughter of the soil. And as Dr. Pinto mentioned, giving away a lot of our little secrets, this medical school journey started many years ago. I started my academic career at St. Augustine's College. So I am a SACR, right? So that started my pivot, into my academic life. So when I started medical school, I thought that I was a sure-in for pediatrics. So I started thinking this is my route or my road to the world of pediatrics. When I started doing my rotations, I was introduced to the world of psychiatry. And so the thought was, interesting. So maybe child and adolescent psychiatry. When I decided to specialize, my mind thought, how can I plug all of that together? So initially the thought was a triple board program where I could do pediatrics, child and adolescent psychiatry, general psychiatry. And so that was my first gear. So my en route to that, I started when I went off to do my residency. I did my residency at SUNY Downstate in Brooklyn, New York, got into psychiatry. And when I started to speak to colleagues and talk about the triple board program, everybody was like, even though I'm triple boarded, usually you choose one. So you may veer on to child and adolescent psychiatry, or you may decide to do pediatrics. So, I then decided, okay, let me pivot, let me hone in, and I decided to focus my attentions on child and adolescent psychiatry. So completed that fellowship at St. Luke's Roosevelt, Columbia University, also in New York, and then decided to work at Bradley Hospital in Rhode Island for a few years. And, had those moments working there, which I absolutely enjoyed, thoroughly enjoyed, but would have moments of, here I am dealing with these kids whom I enjoy and love, what's happening with our kids? And then I made the decision to transition back home. And a few years later, here we are.
Did you ever have any qualms about coming back? Did you ever consider not coming back?
Absolutely, if I can answer honestly, because we know working in that system, although you work really hard, you're also insulated very well, and a lot of times you're compensated very well.
You rewarded.
You know, so definitely those were factors in terms of the decision, but you know, for me, it always boils down to where I think that I can serve the most purpose and where I can be happiest. You know?
Well, you're very, very much needed. The health of the nation is the wealth of the nation, and the future of our nation are definitely our children.
Yes.
And our adolescents. And unfortunately, we all know we're in a crisis, particularly for boys, young men. We're going in the wrong direction. There are a lot of reasons for that, but I'll let Dr. Francis go start with the questions. We have a million questions, we're trying to find some answers to the problems.
You know, before we go there, I mean, I'm intrigued by her journey and coming home. And what I'd want to know from you, what kind of infrastructure you met, and how has it evolved since you came back?
So when I returned, of course, you're coming from two environments that are similar but very different, you know, just in terms of the way things operate, you know, the day-to-day flow, the way that they approach the practice. So when I came back, what I thought was encouraging was I found that we had the tenets of what could be something sound in terms of providing comprehensive child and adolescent care. You know, now over the years, and let me just say that when you look at providing child and adolescent psychiatry care, it's very different from adults, where, and my adult colleagues may jump in and agree, disagree, but when you deal with adults, it's different because a lot of times the treatment is very pharmacotherapy focused. So for those, that means like medication focused. What I love about child and adolescent psychiatry is we get the opportunity to do things differently, because I feel like it's a very hopeful subspecialty of psychiatry, because we're dealing with kids and children and adolescents who are still developing. So there is a greater opportunity for change. And in order to do that, it's crucial to have a multidisciplinary approach. You know, I can't sit in a room alone and work with a kiddo and do that the best that I could offer them. So when I came back, I was happy to see the tenets of that multidisciplinary team in place. So I'm talking about psychologists, social workers, all of those different aspects of care. Over the years, that support has waxed and waned at times. And you know, sometimes limped along, which can sometimes be a bit frustrating and a bit discouraging. So as we are now, it's still a huge work in progress, you know, to where I think we need to be and where we should be.
So another question that I had, you know, in medicine, whenever you're dealing with pediatrics, child, adolescents, you often have almost two patients, right? Because you have to deal with parents too. To what extent that you have parents involved in your sort of therapy and how you manage mental health in the pediatric population?
Yes. So I first of all love the fact that you recognize that, because a lot of our colleagues don't often recognize that. And I say that all the time. Whenever a child walks in the room, I look at it in terms of two patients, because that child is a product of their family dynamic. And it's very difficult to treat children in isolation. I need to understand what that dynamic is like. I need to be able to kind of pull parents in. And culturally, as you both know, that's often very difficult, you know, because if a kiddo is having a challenge, most time the parents want to just put them on the table and say, fix them, I'm good, fix them, and call me when you're done, you know? And so that culturally is, I think, an ongoing struggle because of the way that we tend to visualize what's happening when something is wrong. Like if a child is anxious or a child is depressed, many times parents are like, why? This child has everything they could possibly need, and us Bahamian parents or products of Bahamian parents, oftentimes we hear, your life is so much easier than mine was, So what could possibly be wrong? So bringing the parent crucial, to understanding, even when the parent is not there. If I have a kiddo that is in one of our children's homes, oftentimes I start with, let me see the social history. Because even though that parent is not in the room physically, that parent is in the room emotionally, spiritually, genetically. So it's crucial to kind of understanding the child.
So a couple of weeks ago, we had a guest, and it was the first time that I heard this term per se, and he used the term motherlessness. We always talk about absentee fathers and stuff, but then he kind of focused on motherlessness and how that impact children. Meaning, women are out and they are basically toiling and they're doing, advancing their careers. How have you seen that impact mental health of children?
Yeah, I think, and that's a great term. Right. But I think that it's important to always acknowledge the fact that, and even, for us as parents, we acknowledge the fact that children have different relationships with each parent.
True.
So a relationship a child have with a mother is very different from the relationship a kiddo has with their dad. And those relationships provide different things in the attachment process. There's a lot of beautiful papers looking at, kids and their development, and they talk about what a child securely attached to a mother looks like and a child attached to the father looks like. And each one of them affords different things that are crucial to that kid. So when sometimes you may have a child that has a mother that is not present, and I use that in quotation marks, that affects that child's attachment, that child's ability to securely attach. And secure attachment gives children permission to explore the world to the best of their ability. So I think, again, culturally, and I'm not just saying it's just here, I think it's something that we experience all over. I think we have gotten to a point where taking care of a child is usually equated to providing physically, right? As opposed to emotionally and, spiritually and all of those other tenets that are crucial to a child's development, And so there are things that a mother or a maternal figure offers a child that are absolutely unique.
Well, when we have, as you mentioned, there's no doubt a fatherless society. We can talk about the motherless society just because 70-80% of our households are basically run by women. They're the primary caregiver, they're the emotional support, they're everything. But when we have one of the most expensive societies, cities, islands, countries in the world, a single mother with 4 kids, 5 kids has to work 1 job, 2 jobs, 3 jobs, hustling to make things work just to put food on the table. It's easy to have no time for that child. So we talk about just parenting, quality time, quantity of time, everything else. So many single mothers with no support from the husband, or don't have no husband, or from the father of the child, have to go right back to work after 2 to 3 months after birth. And that separation can create anxiety in a child that can be scarring and have profound effects on the development and personality of that child. But because of the economics of our society, women have no choice. They have no choice. Yes.
It's hard. And I think that one of the things that I always say that I think is so impactful for me is the fact that in a lot of ways we've kind of lost our village, and community. That for a lot of us filled a lot of gaps. I personally remember growing up and spending a lot of time with grandparents and granddaunts and, people that you call auntie and you realize years later, you really aren't my biological aunt, but you're an aunt, And I think in a lot of ways we've lost a lot of that. So kids are falling through the gaps of that, because you're absolutely right. And a lot of the families that I work with, mom is everything. Mom is trying to do everything, and a lot of times you have mom that comes with her own stuff,
right?
And she's trying to parent kids and kind of provide for kids in a way that they are able to be raised in a way that's healthy and productive, but it's hard. And that's where communities fail, right? And I always say, we're all physicians. And for us, it's easy for us to say that science needs to drive policies because we see it very, very clearly. It's clear to us. But for those that are not in that, and they're not seeing it on a daily basis, and they don't understand what happens to kids from a developmental perspective when certain basic needs are met, they're just carrying on business as usual. So I think the inability of those mothers to do what they need to do is more on the community than it is on them, because we're not closing gaps.
And unfortunately, because of the reality of life, a lot of these single mothers, particularly if they have more than one child, 2, 3 children, they've given up on the hope of having a family, of ever getting married. And that in itself can lead to a lot of despair, a lot of depression, a lot of hopelessness, and they may not understand it, but that can manifest in how they deal with everyone, including their children. And a children's environment is all important. And for a single mother, the main environment for that child, other than the school and the teachers, is her. And I think a lot of single mothers don't realize the negative impact that they do have on their children because they're so angry, because they have their own post-traumatic stress disorder that they've gone through. They've gone through bad breakups, and they feel like they've been, even their grandmother have given up on them, and they're forced to raise a child on their own. And that means that they can be angry to their son.
Yeah.
They can say, you know what, you're no good like your dad. You're never going to be anything just like your dad. You're going to break some woman's heart just like your dad. And that can be almost a prophecy for that child, because that's all he's heard, that's all he knows. And then the daughter will never believe in love, never believe in giving their heart to anybody else. And that fact is just going to ruin our society.
Yeah.
No one believes in love, no one believes in trust, no one believes in a family, future, a nuclear family. But before we go through all this grim and doom, let's talk about some positivity.
Yeah.
I always stress that we don't talk enough about the positive things that we as Bahamians are doing. It's inspirational that you came back, qualified as you are.
Absolutely.
But you are also an author. Let's talk about that.
It's true.
You have a children's book, which is illustrated, called Effort is Everything. It's available on Amazon. You can order it through Amazon or download it online through Kindle. It's also available locally at Logo's bookstore in Harbor Bay Shopping Center. Tell us a little bit about the book, what inspired the book, and what do you want children who read the book to get out of it?
Yeah. Yes, thank you for that. So, as you mentioned, the book is called Effort is Everything. Definitely it's a passion project, right? Because, before the world of medicine, I always thought that I might want to be a teacher, right? And so writing and reading is something was always kind of near and dear to my heart. With Effort and Everything, for me, it allowed me to collide two of my most important worlds, right? Which is the world of child and adolescent psychiatry and the world of reading and writing. And Effort and Everything is a fictional story about a 5th grader who dares to compete in her school spelling bee. So she's struggled with spelling. She's worked really hard to get good at spelling. She finds out that she's chosen, and her family, her village, is like, you can do it. They're trying to motivate her. What did I thought to do with Effort and Everything? So Effort and Everything is not a story about perfection. It's not your typical story. She goes on to compete in the spelling bee and she gets gold. No. Effort and Everything, she does not get gold. But it's all about promoting that growth, what we call the growth mindset for kids. And making sure that kids realize that it's okay to fail. Failure is how you grow. So failure is how you stretch yourself, right? And for all of us, we know that a lot of times we've accomplished things, and on the way to accomplishments, we fail, and so effort and everything is about that. It's not a story of perfection, but it's a story of effort and the power that putting in effort and hard work is crucial in terms of building confidence, building self-esteem, building character. And as a Bahamian, the book was illustrated along an illustrator who is based in the UK. But I told her it was important for me to have Bahamian nuances throughout the book. So you will see the Bahamian flag in the background. And for me, there are certain references throughout the story, like the name of her school that is, honor to my grandparents, So that was the thought behind the book. So just more or less promoting that growth mindset, promoting resiliency to say, you can sometimes fail at stuff, but it's okay. The next time you might get first place.
A very important message, and I think it rings true for so many children in our society. And in many families, they don't realize the stress they place on their children to succeed academically or in sports, etc. It can be overwhelming to a 6-year-old having a sleepless night because they have a spelling test the next day, and they're crushed. Their self-esteem, their happiness, their peace of mind is dependent on a grade or dependent on a mark or a place. Competitiveness is wonderful. Dr. Francis and I always talk about it's great to push each other and to want to be the best, but sometimes it can be very destructive when if you're not number one, then your whole life is a failure. And they don't realize life is more than an exam. And there are thousands of exams you're going to do in a lifetime, and none of them are going to define you. But when a child is afraid to come home because they got a B, or because they came second or third in an exam, or they collapse on the ground crying and are afraid to meet their parents when they come to pick them up because they got a bad grade. Parents have to realize that destructiveness that they're putting in them. And even worse, one week that child might be crushed because they came third, and then the week that they came first, the following week, they're actually bullies. They'll throw it in another child's face. I'm better than you and everything else. So we're creating little monsters out there. We have to realize that, of course, you want to succeed, and academics can provide so much in terms of a future. All three of us here are testament to that. But you got to realize, let kids be kids. Let kids be happy. Let them have playtime. Let them enjoy life. Let them have a good night's sleep without worrying about consequences. Parenting is so important. Do you not think that we should have parenting classes that can teach? Nobody knows what to do and what not to do.
Right. I think, as a parent myself, I think it's this continued work in progress, and realizing that, things are very different now from when we were kids, and when you raise a very valid point. When you raise kids that are fearful of failing, sometimes it gets to the point where they don't want to try because they're so afraid to fail. And that's scary for me, because when you have kids that are afraid to that extent to fail, they miss out on their potential.
Absolutely.
And so I think that, the times are shifting. I feel like, people are becoming more open to having that conversations instead of just Xing it at, well, I was like that as a child, and that's how I was raised as a child, and I turned out fine. And I always say, are you really, though? Are you really fine? Because I think that's something we have to learn, and the way that we were raised is different, because children today, their lives are so different. Most kids, they always have their cell phone or some device, and I always call them the generation of immediate gratification. With us, when something bad happened at school, you didn't have a cell phone, you had to go home and process it and possibly problem solve, right. And then you come back the next day and you address it. With them, it's not like that, and that's the nuances of this society that they're being raised in. So
and then many times before the parents even pick up their child, they already know the grade because it's already been emailed to them.
Yes.
But then you brought up a wonderful point. are living in a world of technology, and that brings up the issue of bullying, and not just bullying, but cyberbullying. So, which often can be done anonymously, assaulting, and we can even put it to the word violently assaulting a peer without any consequences, just from your bedroom, from your living room, on a phone or on an iPad or a tablet. And that can be so destructive, where children don't even want to go to school because of the cyberbullying. It can lead to depression. It can lead to anxiety. It can lead to suicidal ideations. How do we deal with not just cyberbullying, but bullying in general?
So one of the things that, and I'm talking about child and adolescent psychiatry, so I'm going to use the word love many times. So one of the areas of child and adolescent psychiatry that I love that we talk about is this whole concept of social emotional learning. And social emotional learning tells you, and the beautiful thing is we now have so much research that supports it, that kids that are happiest, they learn the best. So when you have a school environment, right, we and I know we're kind of all over the place, but we talk about PCEs, which are positive childhood experiences. And positive childhood experiences are those things that are opportunities or experiences in a child's life that actually positively contribute to that child's development. Connectedness is one of them. And so when you have environments in the community, in schools, where the focus is on social emotional learning, so school curriculum that has themes for the week. This week the theme is kindness. This week the theme is respect. Instead of waiting for something to happen, like a kiddo being severely bullied and then everybody's jumping all over it and trying to kind of address it, when you now become proactive and you practice social emotional learning where you're nurturing kids that are mindful, kids that are kind, kids that are respectful, you mitigate or you lessen the chances of bullying happening. Or if it happens, you have enough kiddos around that have taken that in to be able to say, well, so-and-so is doing something unkind, So I think that, again, it takes the village, and it's going to take a village, because bullying is honestly a huge, huge challenge.
I mean, when a teacher in a typical government school has to cope with 45 students, how can they police bullying? How can they nurture a child that needs extra attention? How can they recognize that a child might be being abused at home when they're just overwhelmed with just trying to cope and stay above board? We need smaller classes. We need to have more counseling in the school. We need to have child psychiatrists meeting with troubled youth in the school. So we need more of you. I mean, you're a beacon of hope in the darkness, but we need more of you. And I hope you can...
need more light to illuminate the darkness.
Exactly. I hope you can inspire another generation of child and adolescent psychiatrists. But we spoke about it last week. We talked about ADHD, attention deficit hyperactive disorder, and the overwhelming number of persons, not just in our country, but throughout the world, who are diagnosed with ADHD. 1 in 5, 1 in 6. And the first answer is always to medicate, Correct. And we also discussed we need to look at the cause of them being hyperactive, the cause of them being having behavioral disturbances in the classroom. What do you think? Why do you think so many children are troubled in our Bahamian society?
Yeah. So when you look at ADHD and depression, anxiety, and I always say to my parents, because as a parent, if you have a child that comes in with ADHD, anxiety, depression, as a parent, the first question is going to be, why? Like, what happened? And I oftentimes say it is not just one thing. It's always multifactorial, because as a parent, that can be really heavy. I think a lot of our psychiatric disorders have a very strong genetic component or genetic predisposition, right? But that's not the only thing, and it's very similar to any other illness we deal with in medicine. We might have diabetes in our family, but it doesn't necessarily mean that we're going to be a diabetic. ADHD is one of those childhood disorders that there is a genetic component that is associated with it. And I agree with you. Sometimes the assessments are very rushed, and I always say not because it looks like ADHD, that means it's ADHD. I have had kids with trauma histories that come into the office and it looks like ADHD, but when you do your comprehensive assessment, I'm like, this is not ADHD, this is trauma, or this is not ADHD, this hypervigilance, this restlessness is actually anxiety. So I think it's important to always make sure that you're backing it up with a proper assessment. And even if it is ADHD, or even if it is anxiety, even if it is depression, there are steps oftentimes that you take before just jumping to medicine, depending on the severity of the presentation. So I feel as if a lot of people, they kind of, when you're dealing with mental illness or mental challenges, it's not a topic that people are comfortable with. And so the thought is, I want it fixed as quickly as possible.
Boys are in crisis in this country. We try to chalk it up to a fatherless society. They don't know their father. They're angry because of that. They don't have the guidance of a male figure. There are not enough male teachers in the school. But then you look on the counter where half of our society are women. Young girls are maybe outnumber the boys a little bit, and maybe 52%, 55%. Why are the young girls across the board succeeding where the young boys are failing? They all come from the same fatherless homes. They all come from the same impoverished homes and where they may not see their mother because their mother's working all the time. What is it about young girls where they're not committing all the murders? They're not committing all the armed robberies. They're not the ones who are usually drug addicted or alcoholics. What is it difference between the males and females in our society? And we need to answer that. And obviously, it's multifactorial, but we need to find a solution.
Right. So I'm sitting with two very illustrious male figures. I'm so interested to hear what you guys' thoughts are, but I will say this. Culturally, the way that we treat, respond, approach, expect is very different between boy and girl children. Very, very different. And speaking with one of our esteemed professionals, he was mentioning the fact that, and he's done a lot of research, with our young males in the community. And I remember I was at a presentation recently, and he was mentioning the fact that a lot of the boys that he would canvass in the community, they would actually be embarrassed to talk about doing well in school because that was not cool.
We speak about that all the time.
So
a lot of men feel emasculated by, even if they give the effort, falling short and being beaten by a girl.
Right.
So they'd rather say, you know what, I don't care.
Right.
I don't care if I get a D in math. I'm not going to study. I'm not going to. So they only get the opportunity for a woman to succeed over them.
Right.
And then obviously it's this whole issue in our culture where men are looked upon as less than if they are successful academically. And we see it. When I was an intern, almost all the other interns were women. We see it even more now, where 90% of the medical schools are women.
I think we nurture our we have a call. Okay.
Good evening. We have a call coming. This is Urologist Speaks.
Yes, good evening, Dr. Pinto, Dr. Wesley Curling Francis. Dr. Francis?
It's Dr. Francis.
Not Curling.
Yeah, well, just trying to make sure. You want me to make sure I get it right. And then the young lady in there, I just was calling because what she's saying is very intriguing.
Dr. Richards.
Oh, all right. All right, yeah, because I'm frightened, I'm 61, and I have a 3-year-old running around, right, Dr. Richards?
Okay.
And I'm listening to your input on psychoanalyzing them, right? And so the father figure is much needed because in my observations, right, of course he's addicted to mom, right? But the thing I notice is whatever my 10-year-old does to me, he does to me. So if she comes to me and say, give me a hug, and she says, I love you, he would say the same thing because it's a bigger sister.
Right.
And so, and I'm kind of like from born in the 60s, so I'm observing the social engineering of the children nowadays, the mindless scrolling on the devices, et cetera, et cetera. And I'm juxtaposing this to their behavior. And so what I'm noticing is a lot of young people, it seems to me as if they're crying out for attention. They want to be seen and they want to be heard. And so even as it relates to the young ladies, they are more louder than back in the days. I guess, I don't know. And so I'm looking at the homes and the various backgrounds that these people come from in these schools, et cetera, et cetera. And I observed something at a school where, bullying takes place, but I don't see anyone supervising the children out on the play field, like somebody's not an overview looking to see, for these type of behaviors and these type social networks. But for me, I have a question for you is, how would you juxtapose hours of endless, mindless scrolling? Because I see my son, sometimes I get angry when he's so ecstatic on these devices, laughing and talking and so engrossed into this foolishness, right? So we can use it for positive, but of course they use it for school, but you have to supervise them because they would deviate from what they're supposed to be doing. And he would just get so engrossed in this phone. And I'm looking at this, and I got to count the hours they're doing on it. And so does this have anything to do with, because attention deficit? Because I feel as if after years of doing this, they can't pay attention. The attention span decreases. And this is what I'm seeing. But how is that juxtaposition? Because it's clear, and as it relates to the young men, Dr. Pinto is right, probably statistically, but, a lot of young females are on drugs. And I know, there's a young lady I knew, she was very beautiful, but she's not on drugs. But she, for some reason, she's out of it mentally. So I saw her one day because she was beautiful and she had these white teeth and she's younger and, she was like, what happened was her dad had killed her mom, right? And so I'm noticing her years later. I don't know what all happened in between, but she's out of it. She didn't even recognize me. She's walking the road and it's hurtful to see. I know a few females like that. That's what I'm saying. There's no intervention. And so I'm looking at this all around psychological fallout and the lack of intervention by society. We're losing like that because there's nothing being done, given that there's a proliferation of mentally ill people on the streets. They are impeding you when you're driving. Nobody seems to care. So I just hang up and listen because these are my concerns as an elderly person. I just like all of those juxtapositions. I'll hang up and listen.
Well, you're still young, 52.
Yeah, 61-year-old.
But you mentioned a lot about substance abuse. That's a major issue in our society, and we have far too many pregnant alcoholic women, children born with alcoholic syndrome and all the medical ill health effects of that. We even look at the culture going back, grandmother, great-grandmother, great-great-grandmother. What are we teaching our mothers when it's the norm in too many homes? Even one home is far, but we see it all the time. We talk about when a child can't fall asleep, 3 months, 4 months. Give them a little bit of whiskey, give them a little bit of vodka, give them a little rum. While that child is developing, while that brain is developing, they are getting hooked on alcohol. So when they go on and at they're 8 years old, they have that thirst for alcohol. When they're reliant on alcohol every other day when they're 14 years old. We need to address that as well. So not everything passed down from one generation to the next generation is doing our society good.
Listen, I always believe that we all are just one main crisis away, the important crisis, to having a severe mental breakdown. I think none of us are exempt from such a thing. But I believe that we all have some sort of protective factors that help us to cope or to deal with that. What have you noticed in terms of, how do we prepare just like how we prepare for every other thing.
Right.
From a mental health perspective, I think because we don't focus on that enough.
Right.
How do we prepare people for crisis? Because we always going to have crisis in our lives, right? We're always going to be challenged. It happens. I mean, that's just the way of life.
Yes, yes. And I think the caller, he raised a lot of very good points, and I think that a lot of times we underestimate our superpower as parents. I say to every parent that walks in my office and we're trying to kind of understand what's happening, I always say, you're the expert on your child. There are things that information you could give me as a parent that I would never be able to ascertain from an assessment. You mentioned something really, really important when you talk about protective factors. And I think that's when we look at being reactive versus proactive, that's something we need to focus on, because I agree with you. You may have two people that experience the same really traumatic experience, and only one of those persons may end up with PTSD.
Right.
And a lot of it has to do with their protective factors, right? It's not just chance, and that may be stuff like maybe they have a strong family support. Maybe they have a family where they could go and sit and talk about what happened. Maybe they, have a family that has put effort into building connectedness. So they have a community. They have a family that really talk to them about problem solving. I mean, we're all physicians in here, and I know by nature of that, our problem solving muscle is very strong. And so as parents sometimes, or as persons for me working with children, I oftentimes have to learn to sit on my problem solving muscle to give them a chance to problem solve, because that's how you build. And you described it without calling it resiliency. And resiliency says to us that not everything is going to be easy or hard, but resiliency teaches us how to move through it. And that's, I think, the thing that is missing for a lot of our kids. We're not showing them how to be resilient, and that's a huge protective factor.
Oh, we have another call coming in. Good evening. This is Urologist Speaks. Go ahead.
Hello.
Yes, good day.
Good morning. Good afternoon, Dr. Pinto.
Yes, sir.
I'd like to speak with Dr. Francis.
Go ahead.
Dr. Francis.
Yes, sir.
Last week, Dr. Pinto said you were from 2nd Street. Does the name Miss Roberts ring a bell?
Miss Roberts. It's not ringing a bell right now.
Okay, remember where you all used to live? Miss Roberts owned the apartment?
Okay, yes.
Okay, I'm her son. And I
Okay.
realized who Dr. Pinto was talking about when he said 2nd Street, because I remember the struggle your mother was going through to make sure you go to school. And you were always there. Because when I came back from college, I used to come and collect the rent.
I remember
And
you.
he was always in there studying.
It was
He
a
told me
success
one
story
day-
from then.
There you go.
Yes, he has a story. He's not telling you all of it. His mother went through a struggle to put him through school.
I knew him from then. I know him from then. That's why
No, you don't know him from then. I was a little boy.
I admire him so much because I know him from then.
And my dear, when I heard you say Dr. Francis from 2nd Street, because I always wondered what happened to him.
Wow. Yeah, this
And
is
when you said 2nd Street,
He achieved the heights of greatness.
well,
yes.
yeah.
And I don't know if he remember me and my family.
I remember you.
Yes, man. I'd like to run into you one day. Shake your
Yeah,
hand.
we should do that.
That's a hell of an accomplishment.
Yeah, we should
Your
do that.
mother went to Great
Definitely.
Smiling. You completed the task.
Yes, sir.
She would be very, man, somebody like her need to be honored for what she went through to make sure you went to school.
Well, we talked about motherlessness, and we talked about how the attachment that children have to their mom. I mean, I certainly had that.
And resiliency, and how it boosts that.
Yeah, and she struggled a lot, and I learned how to struggle.
They don't know half the struggle your mother went through.
No, yeah.
You got it. Only me and your mommy know, and my mother,
Yes.
and you.
Yes, sir.
You can't I ain't gonna talk all that, but your mother put up and she did what she had to do, boy. You made her proud. I must give it to you. I'm proud of you now. Once I realized
I appreciate you calling.
One day I hope to run into you.
Yep, I'm sure that's going to happen. It's a small town.
Yeah. And now I'm seeing doctors plenty now. I live up in the age now, so all I'm doing is seeing doctors.
Okay.
So, well, man, I'm proud of you.
Yeah, man.
I'm proud of you. Okay.
All right.
All right, thank you very much for the call. So we're going to talk a little bit more. We'll talk about where does emotional regulation in children originate and more with psychiatrists Dr. Annalease Richards and Dr. Wesley Francis.
Beulah gal, can you believe this? We are now the patrol queens of the neighborhood.
We now large and in charge. So we need to check out what's going on in everybody's yard. What about that gun that we know that Junior and his homeboys just ran out? Can we report that too?
Of course we can.
But we could be in deep trouble if they find out.
We need to report what we see, Beulah. When you call Crime Stoppers, they just answer your call in Miami.
So then we can report everything? Guns, where they hiding the drugs, who shoot who part of which gang, or who disturbing the peace with the loud music and the motorcycles.
Then our neighborhood will be the best in the Bahamas, and everybody gonna want to come live here. And then our house price will go up, gal.
So what we waiting on? What's the number?
If you see something, say something. Let us all pitch in and stop the crime before it's your time. Call 328-8477 from Nassau or 242-300-8477 from the Family Islands. Or text us through the Crack Crime Bahamas app. Stop the crime before it's your time.
Always on the go? Missed a show? You can now listen to Guardian Radio talk shows anytime, anywhere on Spotify and YouTube by searching Guardian Radio 96.9 FM or by entering the name of your favorite show. You can also listen by logging on to GuardianTalkRadio.com and clicking on the podcast tab. Guardian Radio, continuing to provide you with fresh news and smart talk anywhere, anytime, all day.
You try to rest, but roll with the best. For all your printing needs, there ain't no one better, no. For posters and banners, magazines and flyers, for window decals, greeting cards and newsletters. No job too big and there's no job too small. You name it, we can print it, just give us a call. Let Print Masters bring your masterpiece to life.
Located in the Nassau Guardian Building, telephone 302-2361.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Welcome back. This is Urologist Speaks with Bahamian Urologist Dr. Greggory Pinto and a co-host, Bahamian Surgical Oncologist Dr. Wesley Francis, and we're pleased to have as our guest today, child and adolescent psychiatrist, Bahamian Dr. Annalease Richards. We have another call waiting. Good evening. This is Urologist Speaks.
Good evening, Dr. Pinto.
Good evening, sir.
How you doing, sir?
I'm very well.
That's good. Good evening to the two other doctors in the tour.
Good evening.
Good evening.
Yeah, but I'm calling. I want to ask a couple questions. Hey, Dr. Pinto.
Yes.
I compliment you, man. I saw my cousin on the weekend, right?
Yes.
I mean, I'm a year older than him, right? I saw my cousin, right? Man, my cousin looked so fresh. I said, well, you look his dress, but he said, well, yeah, boy. He said, well, I could be look like that. He looked dead young, boy. So, I don't take no kind of pills.
Sounds good. Sounds good.
I don't take no pills, though. No blood pressure pills. No kind of pills.
Okay.
That's a bad thing or a good thing?
It all depends on what you need. So you always have to get your annual physicals. I stress. If you have high blood pressure, essential high blood pressure, and you need medication, then you need to take the medication. If you have diabetes,
high blood pressure, when you have high blood pressure, it'll be from getting you up. Like, what are the symptoms?
That's the problem. It's a silent killer. You'll have no symptoms until it's too late. One of the earliest symptoms in men would be erectile dysfunction. Yes.
Okay. Hey, but doc, my thing with doctors, right? Because I see I ugly, right? And then my place around hospital and clinic, I get ugly get really bad. And the ugly start a better chance facing dead anyhow, because
dead ugly, and death could really reason better. You see, a pretty person will get scared of death because death will frighten them. But doc,
Yes.
my thing with the whole medical fraternity, like with doctors, right? How is it that? I mean, like life is the most precious thing, right?
Correct.
And all other like trades, they have to get their license and they have to be like professional and say that they ain't practicing. How could y'all be practicing on people's life? And then the internet, they take internet and y'all training to be doctor, but then you still practice, so that means everyone taking internet after time.
Well, nobody.
And I give y'all trillions of hours to think y'all still practicing.
Medicine is a hierarchy, so obviously you may interact with the intern, but the intern really has little to no role in your actual management. It goes up in terms of seniority, in terms of experience and qualifications, etc. So every team is led by a consultant, and then you have a senior registrar, then you have a registrar, then you have a senior house officer, then you have the intern, then the medical student. So everybody has their role. At one point, every senior consultant, such as Dr. Francis, was at one point a medical student and an intern. But what the decision making is ultimately always made by the consultant. That's where the word comes from.
Can I ask you one last question?
Yes.
So like to see a human life from birth to death, right?
Correct.
Is it possible for humans to just live their life without taking all them vaccines and all this and that, and to see how long humans will live in actuality, other than disabled to have these chemicals in our beings from birth, and then their lives would be like you say, they give a street content.
Well, that's a complex question. It requires a complex answer, and it's going to open up a whole lot of debate. I think we'll have to have a show just on that. But I thank you for your insightful comments, and thank you for calling in. So when we talk about parenting is all important, but we talk about stressing, being there for your child, being there and giving positive time. It's not just the quantity of time, but also the quality. But giving a child everything can be just as destructive as giving a child nothing. And I see that all the time, Dr. Francis. I'm sure a lot of our colleagues, they say the word proverbial silver spoon. They were given everything. They didn't have to work for anything. They don't appreciate everything. That's why if you look generation after generation in our society, there really isn't much in the way of generation wealth, because after 2 generations, usually the wealth is gone. So you always have to spoil the child and to some degree give them a better life than you had, but you also have to make them understand that you have to have a hard day's work to achieve anything in this world, and you have to have that knock. So sometimes you don't want to solve all of your children's problems. You want your children to make some mistakes and deal with the consequences so that they can learn and they can grow. The problem is that you ask someone to be a parent, and maybe they don't know what love is. They never had anyone parent them. They are just as lost as the child they're trying to rear. And that is too common in our society. What is the answer for that?
When I was in training, at the end of my child and adolescent psychiatry fellowship, we all had to do a presentation on a topic. And to this day, I continue to be fascinated by the concept of having that one person. So everybody needs a person. And so like you rightly said, for some of our kiddos, that may not necessarily be who you think the person should be, like a mom or a dad. But I think, again, we're back to the village, right? If we are able to, as a community, as a society, as a country, find opportunities for kids to have that person, right, who can guide them unconditionally, who can support them unconditionally. I think that's something we really need to work on. There are some organizations in the community that I think are really working hard to do that, but it's not enough. And I say that because in my work with child and adolescents of various socioeconomic status within the country, a lot of times myself and my team, we are searching to find that one person for a child, right? Because we can't underestimate, and the first caller talked about the whole concept of modeling. He mentioned the fact that, you know, the younger one would see the older one coming and giving him a hug, and she's coming and she's giving a hug, or a lot of times for our kids, they may see the way that their parents interact and they're trying to model that. So I think we need to provide opportunities for kids to be able to get that support, to get that connectedness, to be able to model things that are positive and model people that are positive, especially if they're not being provided with that.
So, you said something just now that triggered me in a way. And remember the caller spoke about, he talked about social media essentially.
Yes.
And in the absence of a village, in the absence of a community, and that's what we find ourselves in now, social media has kind of crept into that. And then you have these influences, right?
Correct.
I mean, that's the term that
That
they use,
is,
influences.
yes.
So to what extent do you think social media and influences now have become or replaced that community or village that we traditionally had?
Yeah.
And what's the negative effects of that?
Yeah, scarily so. Because I agree with him, because he mentioned the fact that social media can be an amazing thing, but social media can also be a very dangerous thing. And you're right, it's thoroughly infiltrated the lives of our kids. And in some ways taking over, because you have some kids, they get all their information from social media. A lot of times when I have, I'll give you an example. A kiddo recently presented with, really depressed, self-harm behaviors. And the parents were like, I don't understand why. And so my thing was, can you bring the cell phone? Let's look at the cell phone. Let's see what was happening on WhatsApp, what the messages are. And kids are very savvy. If we're not savvy along with them, there's all of the social media, the Discord, the Insta, and all of this stuff that they're, soaking up. And so as parents, you need to make sure that, number one, you're monitoring those things. It might be a non-negotiable for children of a certain age. Listen, I need to be your Facebook friend. I need to know the password to your phone. He mentioned the fact that children become engrossed in their devices. But as a parent, that's part of your superpower. You can say, these are the limits around the time, the sites that you're visiting, and you need to make sure that you're educating yourself to be able to monitor that.
We have a caller coming in.
Yeah?
Good
Okay,
evening.
good.
This is Urologist Speaks.
Yes, good evening, Dr. Pinto. Good evening, Dr. Francis, and good evening to Dr. Richards.
Good evening.
Good evening.
Yes, I'm enjoying the show. Dr. Pinto, you mentioned a few things, seeing that you were talking about parenting. You mentioned a few things about things being passed down, etc. Right?
Correct.
And I feel as if, like, when we look at the situation that we're in, that we try to look at it from as a comprehensive perspective as we possibly can. Right now, being the people, right? We came from oppression and slavery, where individuals who were adults were treated less than human beings while in captivity, right? When those individuals were set free, those individuals didn't have any idea about parenting. The only thing they knew is the things that they experienced, and that's why I feel as if, like, physical punishment, extreme physical punishment was so normalized among when we were children, because that is what they learned. You know what I mean? They didn't learn about being there and emotional stability and all of the different things that were needed in parenting. You see, so my question is that, or my observation is, if a people has experienced that type of lifestyle for all of those years and they didn't learn those skills, right? Then what type of institutions, what type of knowledge and training needs to be put in place, right, in a society of individuals like that, for them to develop the skills that are necessary for us to be proper parents and for us to be the ideal, what we need to be. Because if those things, right, have not been instituted within our society, right, then then it explains why our society continues to get worse. We find ourselves in this quagmire, right, where we continue to deal with the symptoms of a problem that continuously gets out of hand. You know what I mean? When I look at the society that we live in today, like, I see no solution. I see no hope. The only thing I see is things continuing to get worse, because there are no institutions that are put in place that is about changing the mentality of the individuals. Like how Dr. Richards was talking about having certain theme days or things in school where individuals learn through that association, that socialization, right? See, that is the thing I'm talking about. See, You can't have those things on a date. We need those things in a society. You understand? So my point is that because my father's father, like who taught my father to be a good father? You know what I mean? We are still in the process as a people who were oppressed by another people, right? We are still in the process of trying to develop an idealism for being parented. You understand where I come from? Because for me, I hope you all understand the point I'm trying to put forward, because we need to look at this in a comprehensive way. There's a Dr. Joyce something. She has this thing called post-traumatic stress. Thing I'm talking about how slavery has impacted us even to this day, and it dictates the way we associate and socialize to this day, and so so I'm just trying to figure out how are we going to solve this problem if we don't look at the root of it. You know what I mean? So are we going to just be satisfied with just dealing with the symptoms? Because I know all of you doctors in here, in the room tonight, would confess that our society is in a state of like no return. There's nothing in our society that is being put in place to correct the institution, to correct the problems. Only individual efforts that individuals like Dr. Richards and Dr. Pinto and Dr. Francis may be conscious of, but collectively and as a whole in a society, we doomed. You understand? I hope you all understand the point I was just trying to relate. But I guess it's a good show. I'm going to sit back and I'm going to enjoy the show. And it's good to hear from Ms. Richards, because I know her from years ago. So it's good to hear that she's still around and doing good things. Good to hear. Good show, Dr. Pinto.
Well, thank you very much. So a lot of food for thought. We can't give up, no matter how much doom and gloom and despair. If we have enough bright lights come together, we can have a raging fire in the darkness, and we can make a change. And the good people outnumber the bad in our society. We have to remember that. I would disagree. We can't be blaming everything on slavery. Slavery doesn't make you beat your wife. Slavery doesn't make you have 10 sweethearts. Slavery doesn't make you not study in school. I think we're way past that. The color of your skin, we don't deal with racism per se in our society. The color of your skin is not going to change the path of your life or dictate the path of your life. That's where we have the advantage over so many countries in the world, that the color of our skin is not an impediment. There's no prejudice is going to hold us down and prevent us from attaining our greatness. And slavery, generations and generations ago, was probably the greatest tragedy upon mankind. But we can't blame slavery on why we're going around robbing people and raping people and getting 12-year-olds pregnant. Please, we need to blame ourselves, and we're supposed to be a Christian nation. What are your thoughts on that, Dr. Francis?
I do believe that there is a component of it, right? I don't think to the extreme, but I do believe that over the course of generations, things got passed down and certain behaviors were normalized, and I think that's what the caller said. And the whole nurturing, when you are not ever nurtured, then it's a learned behavior. I think it's a learned behavior, and if you never learned it, then how do you teach it? And a lot of things are taught from generation to generation. Culture is something that is taught, right? Really, right? So I think if you went through, I think people who went through that, and are people who went through that, there is still some evidence of that governs the way we behave. But I agree with you. Accountability, we're more aware now. And self-awareness is an important aspect of who we are nowadays. And so we could change that. So there's an element where we have to take the responsibility to change.
And nobody can hold you back but yourself.
No, right. But especially, knowledge has increased. And with knowledge, that's the advantage that you have. And then you always have to apply yourself.
The 1 hour went very quickly. I think this is part one of a 10-part series with Dr. Annalease Richards. Thank you for that agreement for 10 parts. Let's hear your closing remarks, Dr. Annalease Richards. And then also, please, there are a lot of people hurting out there. Tell us how a parent can get a hold of you or adolescent can get a hold of you for help.
All right. So I just want to first just to say to the last caller that I think that advocacy, with voices like your own and voices like those in the room, because I started off by saying that science needs to drive policy. And I think that as communities and as persons that make decisions and persons that make policies, we now need to make sure that we have policies in place to make sure that the supports, the personnel, and all of that stuff is in place so that we can now start learning things differently. So I will say that. It's always hard when you talk about change, but we can start simple. So my advice or a tip I would give to everybody listening out there, gratitude is a very huge thing. Dr. Pinto talked about giving kids everything and how that impacts is, compared to giving them nothing. But when we focus on gratitude, and that's just being grateful, and just getting into the habit of when kids come home from school, just being able to get into a routine. Tell me one thing you're grateful for about today, because we know that actually changes the wiring of the brain, right? It's been a pleasure to kind of be here with.
And where can someone find you who needs your help?
Yeah, so publicly, I am with the Public Hospitals Authority, Sandilands Rehabilitation Center. We do outpatient clinics on Fridays by appointment. You can reach out to Sandilands at 364-9600 to get more information. And privately, I'm at the Family Medicine Center on Blake Road, 702-9310. And those are the two key places that you can reach me.
Well, thank you very much. And we have at least 9 more parts to go.
Yeah.
There you go.
Thank you very much, Dr. Wesley Francis. And again, Dr. Annalease Richards, my comrade from internship. Thank you for coming. And have a good night and a safe week, Bahamas.
Good night, everyone.
Give up on hope. Don't be ashamed. It's time to take control. Get some help from the urologist.
You will find
He'll help you solve your problems on 96.9